A hospital is a healthcare institution providing patient treatment with specialized staff and equipment. The best-known type of hospital is the general hospital, which has an emergency department. A district hospital typically is the major healthcare facility in its region, with large numbers of beds for intensive care and long-term care. Specialized hospitals include trauma centers, rehabilitation hospitals, children's hospitals, seniors hospitals, and hospitals for dealing with specific medical needs such as psychiatric problems and certain disease categories. Specialized hospitals can help reduce healthcare costs compared to general hospitals. A teaching hospital combines assistance to people with teaching to medical students and nurses. The medical facility smaller than a hospital is generally called a clinic. Hospitals have a range of departments and specialist units such as cardiology. Some hospitals have outpatient departments and some have chronic treatment units. Common support units include a pharmacy, pathology, and radiology. Hospitals are usually funded by the public sector, by health organizations, by health insurance companies, or by charities, including direct charitable donations. Historically, hospitals were often founded and funded by religious orders or charitable individuals and leaders. Today, hospitals are largely staffed by professional physicians, surgeons, and nurses, whereas in the past, this work was usually performed by the founding religious orders or by volunteers. However, there are various Catholic religious orders, such as the Alexians and the Bon Secours Sisters, that still focus on hospital ministry today, as well as several other Christian denominations, including the Methodists and Lutherans, which run hospitals. In accordance with the original meaning of the word, hospitals were originally places of hospitality, and this meaning is still preserved in the names of some institutions such as the Royal Hospital Chelsea, established in 1681 as a retirement and nursing home for veteran soldiers. Etymology. During the Middle Ages, hospitals served different functions from modern institutions as almshouses for the poor, hostels for pilgrims, or hospital schools. The word hospital comes from the Latin hospes, signifying a stranger or foreigner, hence a guest. Another noun derived from this, hospitium, came to signify hospitality, that is, the relation between guest and shelterer, hospitality, friendliness, and hospitable reception. By metonymy, the Latin word then came to mean a guest chamber, guest's lodging, and inn. Hospice is thus the root for the English words host, hospitality, hospice, hostel, and hotel. The latter modern word derives from Latin via the ancient French Romance word hostel, which developed of silent s, which letter was eventually removed from the word, the loss of which is signified by a circumflex in the modern French word hotel. The German word Spital shares similar roots. The grammar of the word differs slightly depending on the dialect. In the United States, hospital usually requires an article. In the United Kingdom and elsewhere, the word normally is used without an article when it is the object of a preposition and when referring to a patient. In Canada, both uses are found. Types. Some patients go to a hospital just for diagnosis, treatment, or therapy and then leave without staying overnight, while others are admitted and stay overnight or for several days or weeks or months. Hospitals usually are distinguished from other types of medical facilities by their ability to admit and care for inpatients, whilst the others often are described as clinics. General. The best-known type of hospital is the general hospital, which is set up to deal with many kinds of disease and injury. and normally has an emergency department to deal with immediate and urgent threats to health. Larger cities may have several hospitals of varying sizes and facilities. Some hospitals, especially in the United States and Canada, have their own ambulance service. District. A district hospital typically is the major healthcare facility in its region, with large numbers of beds for intensive care and long-term care. In California, district hospital refers specifically to a class of healthcare facility created shortly after World War II to address a shortage of hospital beds in many local communities. Even today, district hospitals are the sole public hospitals in 19 of California's counties, and of the sole locally accessible hospital within 9 additional counties in which one or more other hospitals are present at substantial distance from a local community. 28 of California's rural hospitals and 20 of its critical access hospitals are district hospitals. California's district hospitals are formed by local municipalities, have boards that are individually elected by the local communities, and exist to serve local needs. They are a particularly important provider of health care to uninsured patients and patients with Medi-Cal. In 2012, district hospitals provided $54 million in uncompensated care in California. Specialized types of specialized hospitals include trauma centers, rehabilitation hospitals, children's hospitals, seniors hospitals, and hospitals for dealing with specific medical needs such as psychiatric problems, certain disease categories such as cardiac, oncology, or orthopedic problems, and so forth. In Germany, specialized hospitals are called Fachkrankenhaus. An example is Fachkrankenhaus Coswig. A hospital may be a single building or a number of buildings on a campus. Many hospitals with pre-20th century origins began as one building and evolved into campuses. Some hospitals are affiliated with universities for medical research and the training of medical personnel such as physicians and nurses, often called teaching hospitals. Worldwide, most hospitals are run on a non-profit basis by governments or charities. There are however a few exceptions, e.g., China, where government funding only constitutes 10% of income of hospitals. Specialized hospitals can help reduce healthcare costs compared to general hospitals. For example, Narayana Rodale's Bangalore Cardiac Unit, which is specialized in cardiac surgery, allows for significantly greater number of patients. It has 3,000 beds in pediatric heart surgery alone. It performs 3,000 heart operations annually, making it by far the largest such facility in the world. Surgeons are paid on a fixed salary instead of per operation, thus the costs to the hospital drops when the number of procedures increases, taking advantage of economies of scale. Additionally, it is argued that costs go down as all its specialists become efficient by working on one production line procedure. Teaching. A teaching hospital combines assistance to people with teaching to medical students and nurses and often is linked to a medical school, nursing school or university. In some countries like UK exists the clinical attachment system that is defined as a period of time when a doctor is attached to a named supervisor in a clinical unit, with the broad aims of observing clinical practice in the UK and the role of doctors and other healthcare professionals in the National Health Service. Clinics. The medical facility smaller than a hospital is generally called a clinic, and often is run by a government agency for health services or a private partnership of physicians. Clinics generally provide only outpatient services. Departments or wards. Hospitals consist of departments, traditionally called wards, especially when they have beds for inpatients, when they are sometimes also called inpatient wards. Hospitals may have acute services such as an emergency department, a specialist trauma center, burn unit, surgery, or urgent care. These may then be backed up by more specialist units such as the following: emergency department, cardiology, intensive care unit, pediatric intensive care unit, neonatal intensive care unit, cardiovascular intensive care unit, neurology, oncology, obstetrics and gynecology, colloquially, maternity ward. In addition, there is the Department of Nursing, often headed by a chief nursing officer, a director of nursing. This department is responsible for the administration of professional nursing practice, research, and policy for the hospital. Nursing permeates every part of a hospital. Many units or wards have both a nursing and a medical director that serve as administrators for the respective disciplines within that specialty. For example, in an intensive care nursery, the director of neonatology is responsible for the medical staff and medical care, while the nursing manager, director for the intensive care nursery, is responsible for all of the nurses and nursing care in that unit ward. Some hospitals have outpatient departments and some have chronic treatment units such as behavioral health services, dentistry, dermatology, psychiatric ward, rehabilitation services, and physical therapy. Common support units include a dispensary, a pharmacy, pathology, and radiology. On the non-medical side, there are often a medical records departments, release of information departments, information management, clinical engineering, facilities management, plant ops, dining services, and security departments.